doctor will examine us and that'll be it. But we thought, in the meantime, let's remember those words that we use when we go to see the doctor, when we talk to the doctor. So feel free to start with our poll. Each week we have a poll question you can chime in on. Let us know, when do you go to the doctor? Once a month, sick or not, go to the doctor once a month.
Consistently. Mm-hmm.
Once a year, for the same reason, sick or not, just kind of get a yearly checkup. Only when I'm sick or injured. Only go to the doctor if I have to go. If that's once a month, once a week, once a year, once a decade, whatever, but only if I'm sick or injured. Or I go to the doctor every day because I am a doctor. That's just a little fun we're having. Christine, how would you say how often you go to the doctor?
Well, there's the what I would like and what is reality. So reality, I see the doctor probably more, and I don't like that. But in my family growing up, it was only if you were sick or dying. Like I broke my ankle once, and it took us 2 days to go to the hospital to actually check, and then it was misdiagnosed. And then I had to go 10 days later after my brother tripped on my ankle, which is very painful. And then we found out that yes, it was broken. So we just kind of avoided hospitals when we could, but yeah, for better or for worse.
I had a sprained ankle when I was about 12 or so in gym class. And I had never been in such pain before.
Oh, sprains and breaks. I've done both. They honestly, if it's a bad sprain, it can hurt as badly as a broken ankle.
Right.
Absolutely.
And it was funny. I had to go around on crutches for a couple days just because I couldn't put any weight on it at all. It was funny though. We took it. We went to our family doctor, our pediatrician, a doctor who deals particularly with children. And he said, because I was thinking in terms of the pain that this must be broken.
Right. Yeah.
And he said, no. If it was broken, you would be in excruciating pain.
Well,
I was like, you mean there's a level of pain higher than what I'm at right now?
I'm going to die. I'm slightly less because I'm still alive. That's a broken ankle. But a badly sprained ankle is about like I'm going to die feeling. It's terrible.
Anyway, hello, all of you chiming in already. Daisy, good to see you. Good afternoon.
And Steve.
Steve, always good to see you. Agatha, another one of our regulars. Hello. And we have someone here whose English is pen, along with what looks like some Japanese there, maybe, and some Chinese. Hello to you. Good to have you with us. Kei-san, good to see you again, Kei-san.
And also David. Hi, David. Good afternoon.
David, hello. And Agatha, wishing us a happy St. Patrick's Day. We almost could have done, come to think of it, St. Patrick's right here.
I did not plan that.
The color green. Green like the Emerald Isle from which the holiday originates.
That's right.
Ireland and the United Kingdom. And the lass is wearing green to celebrate St. Patrick's. That's my bad Irish accent. But yeah, green, the color is always associated with St. Patrick's Day.
That's right.
Yes, and Agatha thought of it when seeing teacher Christine's sweater and headband.
My body just knew it was Irish Day.
Right.
St. Patrick's Day. I don't know. I just decided green was a good color for today. But yeah, thanks for pointing that out.
Of course, in Taiwan, you see green pretty much every day, but it fits especially today.
Yes,
so
it does.
A nice bit of serendipity there.
Yes.
Big, long word there. Serendipity just means a coincidence that is beneficial in some way. It's two things just happen to come together and it produces a beneficial result for everyone involved. But we are here to talk about talking to the doctor today, so let's give you some vocab words. You can continue chiming in, and the first vocab word let's give to you, I mentioned it a few moments ago when I was talking about the article, very familiar word when you're visiting the doctor, diagnosis. And you'll see it on the bottom of your screen now with another word, diagnosis / prognosis. Two separate words, often confused. That's why we wanted to talk about them together here. So Christine, what is diagnosis and how is it different from prognosis?
Yeah, so a diagnosis is when a doctor does a physical exam, looks at your history, maybe looks at some lab results, and makes a decision about what you most likely have. Sometimes your diagnosis can change as they discover new things, but they basically say, okay, we are pretty sure this is what you have. So that's the diagnosis. Whereas a prognosis is more like, what can you expect with treatment, with how a disease or an illness will progress, things like that. So one is more what it looks like from now on versus the diagnosis is what's wrong with you.
Right. Diagnosis is here's the problem. Prognosis is here's how we're going to treat it, or here is how the treatment is working out or not working out.
Right.
Is that a positive prognosis, a negative prognosis? Well, to some degree, that depends on the diagnosis, on what the problem is that you're treating. So that's the difference between those two words, which you'll usually hear at some point when you see the doctor.
Yes, and I also earlier used the word misdiagnose.
Yes.
So that's when there's a mistake. They thought it was one thing, but it was something else. So for example, with my ankle, they thought it was a sprain, but days later I could not put my foot down, I could not walk. So then they re-diagnosed it, and after an x-ray they found out it was a break. So
that's why it was 2 days before you actually went to the doctor.
Well,
because
we're like, it might be a sprain, but then the doctor also said it was a sprain because I wasn't screaming in pain. I like to hold my pain in. So I think my reaction was not big enough to convince him that it was broken and needed an x-ray.
And that is what led Christine to a life on the stage as an actress, making her emotions and reactions nice and big.
That's right, gotta make them bigger.
So that people would believe her. Yes, that's a very funny, sad story.
It is.
Anyway, let's give you some more vocabulary here. Symptom. Here's another basic word. I bet some of you might already know it. Symptom, S-Y-M-P-T-O-M. Symptom. What does that mean, Christine?
So a symptom is like when you go to the doctor and you tell them what's wrong. So my skin is itchy, or I have a headache, or I have a runny nose. So those are all symptoms.
Right.
And so the doctor can listen to the symptoms and based on those symptoms and other tests, give you a diagnosis.
Right. And symptoms, even diagnosis and prognosis, you will often hear, you'll sometimes hear outside of the doctor's office as well. You'll hear them in different contexts, like if your car is broken and you take it to the garage, take it to the mechanic, you might hear the word diagnosis. Well, Mr. Brown, my diagnosis is that you got a blown carburetor here or something, like that. He might use the word diagnosis, and I, bringing my car in, might tell him the symptoms of my car. It makes this noise when I start it up, or it doesn't brake quickly enough, or something like that. So you might hear symptom, diagnosis, even prognosis used outside of doctors' offices as well as inside of a doctor's office.
Yeah.
And so who have we got here? Agatha. Based on my experiences, it's always better to get a second opinion, especially when you are new to a medical system. For instance, you just moved from country A to country B. Yes. A second opinion. That's a word, a phrase we could have included here. Get a second opinion means talk to another doctor. If it's particularly serious illness or injury that you have and you're not sure if the prognosis is kind of uncertain, you might want to have it looked at by another doctor, get a second opinion to see if that is what the best way to deal with it, if that is in fact what you have, because doctors will sometimes disagree.
That's true.
So it's a phrase you'll hear, I'd like a second opinion. With that, let's go on to another vocab word, and then we got a discussion question for you that you can chime in as well. Here's a kind of a long one, preventive. P-R-E-V-E-N-T-I-V-E, preventive, and you'll see there's a parenthetical word with it, care, simple word, I think we all know what care means, to be concerned or be focused on something, to care about it, to love it even. So preventive care. Christine, what are we talking about in terms of a doctor's visit?
Yeah, so preventive comes from the word prevent, which means to stop something from happening or to keep it from happening. So preventive care would be something like doing a yearly physical checkup, an annual checkup to just make sure everything is working, or doing some scans or that sort of thing. Possibly also teaching you about nutrition or about exercise, things that you should do because of your genetics or because of certain signs in your body, and they want to make sure that you don't end up with a diagnosis of something, and so they're trying to prevent that from happening to you by giving you advice on how to take care of yourself in the meantime. Right,
preventive care. Another word that sounds like it and kind of means similar to it, preemptive. To preempt something is to address it before it's a problem. Because you can see how it might become a problem. It's not exactly the same as preventive, but it's similar to it.
Close.
There is a difference. and you might hear one used interchangeably with the other. They mean sort of the same thing, but there is still a difference. Yeah, in fact, preventive, Joshing. Hello, Joshing, always good to see you. Preventive versus preventative. Ah, Joshing, you've touched on a neat little point about the English language, which is frankly one of my pet peeves, something that annoys particularly me, a pet peeve about the English language, and that is adding unnecessary syllables. Preventative and preventive mean the same thing. They mean exactly the same thing. Just the way language develops, sometimes you will get an extra syllable added in where it isn't really needed. People will say preventative when they mean preventive. You will hear that with the word comment, C-O-M-M-E-N-T. To comment on something makes you a commenter or a commentator.
Yes.
Again, the same thing. Someone who comments, usually in a scholarly sense, in an academic sense. But I always prefer commenter or preventive over commentator or preventative, but anyway, just so you know, they mean the same thing. And I don't know, is this just a pet peeve or?
I would have always said commentator and preventative because that's just how the words have been taught to me. So I've never really thought about it, but yes, we do like to overcomplicate things in English. Sorry, that's just how
Of course, we're either overcomplicating things or we're undercomplicating them. We're oversimplifying them by changing them. Like, remember the Tom Cruise Mission Impossible movies? When it first came out, it was like Tom Cruise in Mission Impossible. And then the second movie, it was Tom Cruise in MI2. MI:2. It's like, let's shorten that down. Let's not write out Mission Impossible again for the second movie. There's something, we like to make things slick in English. We like to make them concise and shorten them. And sometimes we shorten them to the point of incomprehensibility. That's a topic for another time, though. Kei-san chiming in. Seeing a doctor could be quite challenging when people are in a foreign country where different language is spoken, definitely.
True.
Like in the last academic year, I assume you mean your academic year, I was in Italy. Seeing a doctor then was really hard.
Yeah, you have to prepare, you have to think about, okay, what are my symptoms, and maybe Google Translate, you do have to do preparation, or you have to bring a friend, or you have to find a doctor that speaks your language, and that's not always easy. So that's definitely a challenge.
Definitely. Could we go to the poll, actually? I just wanted to get a sense of our poll readout here. When do you go to the doctor? Once a year, sick or not? About 20% of you go to the doctor once a year, sick or not. Most of you only when I'm sick and injured, and that applies to me too. There's at least one of you out there who is a doctor, hello, and you see the doctor every day, ha 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 ha. I wanted to mention the poll question because those of you who go once a year, sick or not, and there's maybe one or two of you who go even more often than that, that's an example of preventive care, to go to the doctor when you're not sick, just to see if there's anything, bubbling, anything that they might want to keep track of so that it doesn't become something worse. That's an example of preventive care. And who do we have? Steve. Hello, Steve. Similar to Daniel Craig as James Bond 007. In which movie? Not quite sure what you're saying there, Steve.
Well, there are other movies with other actors, like also Mission Impossible or James Bond. Right?
I see.
There's so many James Bonds, right? They've rotated through. So
yes, no, very Mission Impossible, James Bond, really very similar ground there that's being covered. Okay, let's give you our other discussion question here. We're going to keep giving you vocabulary too, but here's another question that you can chew on and chime in on. If you were a doctor, trying to sort of bring a little positivity here, a little fantasy imagination, if you were a doctor, what area would you like to specialize in? What area of the human body or what kind of illness would you like to specialize in if God said, you're going to be a doctor and you get to choose what area you want to specialize in? Let us know in the comments. Christine, if you were a doctor, would you be a podiatrist, which is to say a foot doctor, so she could watch for ankles?
Man, I have no idea. That's a really hard one for me. I'm really scared of needles and surgeries and pretty much anything a doctor does. Sorry, doctors. I appreciate doctors. I don't want to be anywhere close to that. So I have a very hard time putting myself in that scenario. But what about you?
So maybe you could be a doctor of the mind.
Yes.
A psychiatrist.
I could be a psychiatrist.
Yes,
that
yes.
would be fine.
Yeah, no, if I were going to be a doctor, and I'm going to kind of assume that I would like to do this. Maybe that's an assumption. But anyway, I think I would probably want to be a doctor of the mind as well. I think, that's an area that fascinates me, how people think, how they behave, what our thoughts are. I think a counselor of some sort, psychology. We could open up a practice.
That's
maybe.
The actors in us talking.
Oh, I think you're right.
Yeah.
Yes. Yeah. No, I think we like the drama.
Exactly.
The drama of the human mind. Anyway, that's a topic. Another topic for another day. Joshing would be a cardiologist. I'm guessing. You just entered the word cardiologist. Maybe you're just sharing that with us. Or maybe that's what you would be if you were a doctor. Cardiologist, of course, a doctor who studies the heart, from the Greek word for heart, cardia. Cardiologist.
And Pen said psychiatrist.
Ah, good. Pen. Yes, certainly a doctor, a psychiatrist, psychologist, therapist, counselor. They have a variety of names. Oh, did we lose the sound? Oh, we're okay? Okay. And Joshing also recommends a physical checkup once a year. Yes, very good. Daisy, if I was a doctor, I'd prefer to specialize as a pediatrician. Pediatrician taking care of children. It's always good to see a newborn baby, which makes me feel hope there, definitely. What does Agatha want to be?
Agatha would be interested in being a family doctor, which I thought about that a little bit, because at least then I don't have to get in there and do too much.
Right.
But yeah, so that you can meet the people, you can hear what their issues are, and then refer them to the necessary specialist.
Right. And Agatha adds that it's because you only mostly do preliminary exam. Good vocab word there. Preliminary means initial or beginning or the first exam, the preliminary exam. And you can refer patients to a specialized doctor whenever you have concerns. Kason probably also like to be a pediatric.
Yeah.
Claire, hello Claire. Don't know if we've seen you
Claire.
before, but you're welcome. Family physician, just like Christine here. And Joshing, a shrink.
That's good vocab there.
Good, little bit of slang language for a psychiatrist there. A shrink. You don't hear it that much anymore. It was sort of more popular in decades past, but every now and then, as we can see here, you'll still hear shrink. Means a psychiatrist. And Practice Noob, hello Practice Noob. Haven't seen you in a couple weeks, I think. I've heard that physician is the least desired type of doctors due to coping with frequent deaths, contributing to a lot of lawsuits. Well, Practice Noob, you've certainly taken the practical approach here. So, keep that in mind when you're choosing your doctoral profession here.
That's right.
We are just about out of time, though, with that said, but let's give you one more bit of vocab as we bid you farewell here. And I think we will go with a nice simple word here, rash. R-A-S-H, rash. Christine, as we were talking before we came on the air, that has meanings both inside the doctor's and outside of it. Do you want to give us both?
Yeah, so physically, if you have a rash, you have lesions on the skin, so bumps or something that's usually itchy and looks not like your normal skin.
Right, just like a red patch,
red patch.
on your skin.
So that would be a rash. But you can make rash decisions. So rash in that way is you're making very quick, not thinking very clearly. Right. So if you talk about someone being very rash, you might be talking about them just making decisions or doing things suddenly without thought.
Right. Hasty, another word that means rash. Hasty meaning quick, but not really thought through.
Right.
Not really considered. Steve, I learned how to keep everything healthy when I was outside because everywhere I see these days, most people sneeze and cough and try to avoid getting infected. Here in our island, we had a rough time with the flu this year, didn't we? There were some high-profile deaths, I think, from the flu, and the masks, I haven't seen as many masks on the subway since the high days of the COVID era. So yeah, it's been a tricky time for us this past winter.
That's right.
And Agatha, rash on skin is so annoying.
So annoying.
Yes.
So annoying.
If you see a rash, go and see the doctor and get it checked out. Anyway, that is all the time we have for today. Thanks so much for joining us. Christine here and myself sharing about what kind of doctor you might like to be if you'd like to be a doctor. And again, this is the article, Dr. AI, that you want to check out in your March Advanced magazine. And we will be back next week, same time, same place, to give you more vocab, help you practice your English with a different topic altogether. But until then, I'm Peter.
And I'm Christine.
Saying the doctor will see you now. Have a good week, everyone.
Bye.
Bye-bye.